My name is Utuba Ndebio. I'm a PGY2 resident in NAMC, Florence, and this is just a brief video about what we do in our teaching rounds. Essentially, we know you, we've studied, we have the medical knowledge and everything, but however, when it comes to practice with living patients, it's different. And that's one good thing we are getting from this program, the teaching rounds. Typically in the teaching rounds, we do most of that during the morning rounds with the attendings, and I would say it's been a very, very, very wonderful experience because the attendings are willing to teach and we're also willing to learn.
I am Manjot Pajwa, one of the PGY1 interns. In each team we have 2 interns, which is supervised by one senior, which is PGY2. And also we have medical students with us who round with us. And then there is clear and specific roles for each one of us, which not only maintains the interest but also improves our interest and more about the knowledge as well.
Basically, most of the teaching rounds is done at the bedside. So what happens typically in the morning, we do what we call a chat review, where we quickly look at the vital signs of the patients. Overnight, we look at their labs that were ordered. And then with the interns go through all their patients. They come and look, they do the quick rounds on those patients. They come back and update the senior, and if there's any patient that's so critical and they think the senior needs to see, we go see the patient together before the rounds with the attending. Now, the beautiful thing about the teaching rounds is that we have variety. We have different attendings with various experiences and years of practice. So we have a young breed of attendings, we have the very senior breed of attendings, which gives us that balance and gives us that exposure to medicine in terms of experience. Also, I would like to comment that during these rounds, we are afforded the opportunity to now to work with the team, how to access information from the nurses, from the clerk, which creates a good team environment, a good environment for patient care. So I would say it's a work in progress, but it's a good work in progress, and we believe if you join us, it will help to create even a better team.
There's a lot of bedside teaching involved each day during the morning rounds. So we have our own assessments and plans, we have case discussions, and then we formulate our own, whatever the plan we go ahead. We also formulate various investigations to go ahead and discuss about the various differential diagnoses, which definitely increases our knowledge of medicine. Not only this, we have small presentations each day regarding various topics, which definitely helps to improve the quality of our work.
During the teaching rounds, we get to know why we do some investigations, why we order some labs, and why it's not necessary to order some labs, and the timing of when these labs and various investigations and order. And like my colleague said, we also try to know what to do. Let's say, I give an example, chest pain. What kind of things we are expected to do when we have a chest pain, so that the next time, even you as an individual without the attending or the second year there, you'll be able to manage these cases. Also, part of the good thing about teaching is knowing how to discharge, which can be very, very difficult. So those are all things we learn during teaching round. The roles we play in the discharge of patients, the roles we play during admission, the roles we play in regards to progress of the patient, and all the people involved. Now, managing a patient in this big hospital takes a lot. We have a big team. We have the nurses, which we have to work with. We have the imaging, the radiographers. We have the case managers and everything. It's a big team, but we all work together for one goal, to make sure we get our patients well and get them home in safe.
Very importantly, one more point I want to talk about is the feedbacks. So we have the feedbacks at the end of our each block, which not only we come to know about our shortcomings, and we are also told like what improvements we can make. So we assess each one of us, and then it definitely helps to improve our performance in the next subsequent blocks.
Documentation is big, and it's an art on its own. Writing good notes and capturing everything about patients can be very difficult. But in this environment, we are being taught daily how to get our notes properly written, and for many reasons. You can do a good job and seeing a patient, but your notes, your documentation doesn't show that you did a good job. And what will be used to judge us most likely in the future, if it comes to that, is what was documented. So documentation is big here. And all the attendings with the experience of even the seniors here all help the residents and everyone to make sure we get good documentation. So I would like to say in a nutshell that the practice is comprehensive. The attendings are willing. It's something we are excited about. The residents are also willing to help, and even the interns are willing. So I would say we learn from each other. We learn from the attendings, we learn from each other, we learn from all the staff. And The goal, like I say, is to make sure we get our patients safe and also you improve your knowledge in the long run as a resident. We're excited to have you join us. And the truth is, we look forward to working with you. And I believe with you, with us, we'll create a big team and make this wonderful hospital one of the best down south. Thank you.
Thank you.